Today I'm going to talk about a very offbeat subject. This is not about plastic surgery. This is just about youngsters being curious and anxious at the turning point of their life, that is just after their 12th. They are wondering if they have to get into medicine at all. Do I take up engineering? Do I do something else? Do I take up art? Do I take up accounts, banking? There are so many options. Now, in that, where does medicine fit in? Really? Is there future? There are so many doctors. There are so many doctors not only here, even abroad. Indians have actually started pouring abroad now in the UK, Canada, US. There are a lot of doctors from India who have gone there. And is there a future for me to take up medicine is one of the very common questions that some of my nephews or nieces ask me, and I'm sure that the same question must be actually in your mind when you are at that phase. Now let me tell you one piece of advice at this point of time. It might appear like preaching, but the thing is, do not take up medicine just as a profession to make money. That will not take you too far. So have a proper goal of why you are getting into medicine, if you are getting into medicine at all. Now there has to be some sort of a service mindset, because initially during your training period, it is usually a very long training period. I almost trained for about 12 to 13 years to be known as a complete plastic surgeon. So that kind of a 12 to 15 year period will be required for you, where you might not be able to earn up to a level of your peers who have gotten into engineering or accounting or MBAs and things like that. But if you stick to it, do everything in the right spirit, and serve the community during your initial training period, I'm sure you will be rewarded later on with whatever financial gain that you deserve. So that's the first thing that I want to make sure, that please do not get into medicine just thinking that you will start earning from maybe year 4 or year 5 of your medical training. Second thing is there future in medicine? Obviously yes. Now the traditional thing of just being a doctor, being a clinician is almost over. Most of the doctors are diversifying their talent. They are becoming doctorpreneurs. They're setting up businesses. They're setting up research institutes. There are a lot of new avenues like artificial intelligence that's coming up a big way in healthcare. We really don't know where artificial intelligence will take us in the next 5 to 10 years. So that's a really exciting period. Face recognition and nanomedicine, nanotechnology, and all these fields are going to be the thing of future. So the medicine field itself is going to evolve quite a bit. Probably and my practice profile is probably 100 times different to a similar plastic surgeon maybe 30 to 40 years back, and similarly it will be very much different even probably 10 years later from now. You might have heard about the knowledge doubling curve, that if knowledge doubled once in 100 years, then in the last century, in this century it will double faster. That's almost in 50 years, then again next in 25 years, and then in 12.5 years. So knowledge always doubles very exponentially. So the things that are in future for medicine is really exciting. So if you are passionate and interested in medicine, I think you should get into it. If you need any more guidance, if you want to shadow someone, I am really open to it. If you want to come and shadow me for a few weeks or months to get to know the feel of medical field, you're always open to contact us, and we'll organize something for you at our center.